Thanks, Acting Speaker, and I proudly rise today to contribute on the Drugs, Poisons, Controlled Substances Amendment Paramedic Practitioners Bill 2024, and I find it a bit ironic that the member for South West Coast says about supporting paramedics when those opposite were at war with paramedics when I was the previous Secretary of the Union only a few years ago. So it's a bit ironic to suggest that they would be supporting paramedics. But anyway, as I say, I was the Secretary of the Ambulance Union for a number of years, and I started the discussions with the former Health Minister, the Honourable Jill Hennessy, back in 2016 about paramedic practitioners, and continued those discussions with subsequent health ministers, Jenny Mikakis and Martin Foley, and of course the current minister, Mary-Anne Thomas, who's now brought this bill into the House, and I'm pleased to say we've finally got there where we're introducing the paramedic practitioners into the state of Victoria. Of course, this was an election commitment by the Andrews Allen Labor government, and we're delivering on that commitment. Yes, there are currently 29 paramedics that are studying the Australian first Master of Paramedic Practitioner degree at Monash University, and it's fantastic, and it will expand their level of care and how they can treat people pre-hospital or out of hospital. And the commitment from the government is, while there's 29 paramedics going through the training of this course and level of care now and practice, our commitment is to 100 scholarships over the next 4 years. So it started with 30. I think there's only 29 that's currently on the course now, and we wish them well with their quite extensive training and an extension of what they currently do as paramedics. And most of them are very experienced paramedics that are doing this particular training. And we know that different models of out-of-hospital care need to be provided. It's been, the way the ambulance service is responding now, we can't keep doing it the same way as we've done it for decades. The increased volume of caseload, I think recently they've had their highest numbers of cases in a 3-month period just recently. And a high percentage of those cases are probably unnecessary emergencies that come through the OOO system. But the ambulance service has to respond. And as the population grows and the demand grows, it's not just about putting more paramedics on the road. And there are 2,000 more paramedics on the road as of today from when this government came into office. When I left the union, we had just over 4,000 paramedics in the state of Victoria. Now there's about 6,500. So the recruitment's been enormous over the last few years into the ambulance service. Of course, the paramedic practitioner, it's a new role, and the whole idea of it is to try and reduce the number of people that need to go into a hospital. It's about treating people at home, and depending on their acuity of their condition, it's allowing these newly trained and extensively trained paramedics to administer scheduled medicines, so they can also prescribe, they can supply medicines, and this was about treating people where they actually are rather than they have to come to an ED to be treated unnecessarily in an ED, probably because it's better for them to be at home, or if it's a nursing home or if it's an aged care facility, then these paramedic practitioners can treat them there, and it's much better for the patients and the patient's family. Of course, paramedics regularly transfer patients with serious but not life-threatening conditions to hospitals. And again, some of the treatment that these paramedic practitioners give will mean that these patients may not need to be transferred to a hospital, that they can be dealt with at their home and recover at home. So it is advanced clinical training. They'll be able to assess, diagnose patients, treat them in the field, treat them at home, treat them in a nursing home, as I said. And again, that would be good for that individual, patient, but also for the ambulance service and the health system. Now, before I run out of time, because I can see the clock, I did mention that they had 29 paramedic practitioners doing the course, and I'm going to read out all of those 29 because it's history making. These people are starting this new concept in Australia, and I'm going to read out all of their names. So these are the ones that are currently practicing, and these will be the first ones on the road providing this level of care to patients out in the field. Craig Beamish, Kim Baker, Philip Bell, Joe Brooks, Ben Carthy, Julia Cosgrove, Sarah Dalton, Nancy DeGran, Sean Duggan, Brian Gansbuller, John O'Harper, Michael Heffernan, Jada Hunter, Robert Kemp, Muriel Kinross, Tennille Lakey, Justin Lancer, Glenn Lazario, Jake Larati, Mark Lazars, Jacob McEwen, Dion Mead, Michael Milotoview, Laura Mowbray, Shannon O'Leary Colivert, Heidi Optinoon, Georgia Ryan, Martin Starrick, Jade Taylor, Amanda Taylor-Hall, Megan Beering, Peter Wagstaff, Bianca Margaret Wilkie. And I congratulate them and wish them well in their studies and in their practice when they hit the road in dealing with Victorian patients and looking after Victorian patients. I should also mention the trainers, Alicia Restaglin and Natalie Fonda, and as I said before, I wish them all well. And I think Brendan Shannon is also another trainer of these fantastic paramedics. I want to give a shout out to all the paramedics around the state. They do an amazing job. Keep up the great work. I know that you're voting right now on your new wage deal. I wish you well. As I say, I started the discussions on this back in 2016 with the Honourable Jill Hennessy. Here we are, 2024, you'll be on the road by 2026, delivering this great service to the Victorians that need it, that will keep people out of hospital, and you can treat people at home, in their nursing homes, in their aged care facilities, for better outcomes for those individuals and better outcomes for the ambulance service, better outcomes for the state of Victoria, better outcomes for the health services. This is a fantastic bill. I commend the Minister for bringing this forward. I commend the government, the Andrews Allen Labor government, that committed this to the paramedics as an election commitment, and I commend that. So thank you. I commend the bill to the House.